So there is a new initiative at EASL, which is the EASL International Liver Foundation. It's been set up to address liver disease in a broader geographic area than EASL would normally cover. As a European association, we're clearly focused on research, political and clinical activities within the European Union. But the International Liver Foundation will allow us, hopefully, to expand the number of people that are involved in treatment and research in liver disease across the globe. And there's a particular focus on what will be going on in sub-Saharan Africa, where there is a huge burden of liver disease due to viral hepatitis and liver cancer. So the EASL Foundation will be able to draw on the expertise of EASL members, particularly some of the senior members and members of the governing board, and use that to influence education programs as well as policy and the increase awareness about liver disease in resource-limited countries. So I'm hoping that the EASL International Liver Foundation will help to develop some really important educational programs to help physicians in sub-Saharan Africa and other geographical areas to not only treat their own patients better, but also to provide education to their colleagues working in primary care and secondary care environments. We'd also very much like to see policies developed by governments in those regions to increase awareness, particularly around viral hepatitis, and to develop some policies which start to address the prevalence of the infections in their countries. So I have really big ambitions for the future in sub-Saharan Africa. So hepatitis B and hepatitis C are really big issues in the region. Most people are unaware of these infections. They are aware of HIV, TB and malaria because there has been huge investment in those areas. We'd like to see viral hepatitis raised up to the same sort of prominence so that people want to address the burden of disease and in particular move towards elimination of new infections and prevention of people dying from these conditions, given that we have successful both vaccination and treatment options available. So as ever at the International Liver Congress, we see new data emerging for treatment of hepatitis C and of hepatitis B. So we've been watching, of course, new developments in hepatitis C for the last 5 or 10 years, and it continues to be an exciting area with even more effective drug regimens, which is excellent. What's fascinating this year is an increased amount of research that is being presented here on hepatitis B, both in terms of public health, but also new options for treatment in the future. So it's quite obvious that both the academic research laboratories around Europe, as well as the pharmaceutical industries, have started to take the idea of a cure for hepatitis B quite seriously. Fatty liver disease is a component mainly of the metabolic syndrome and of course is associated with obesity. Our European population is growing in size and the obesity problems that have been recognized in the United States are now our problems as well. So that there is a huge prevalence of fatty liver disease around Europe in most countries. The problem is we can't possibly biopsy everybody who appears to have fatty liver disease in order to determine the severity of their disease or the likelihood that they might eventually develop cirrhosis. So the big need at the moment is actually for better diagnostics. At the moment, all clinical trials require liver biopsies in order to look at how the progression of disease is altered by drugs. in the future it'd be lovely to see serum-based tests that gave us the same information without needing to biopsy everybody. So EASL has so many benefits to it. So we have obviously the journal, which is now one of the top ranked journals in the field of hepatology. We have obviously the educational provision by EASL, not just here at the International Liver Congress, but a series of monothematic conferences, special conferences and schools that are organised. And actually EASL is a great way of sharing the latest data, the latest research findings, and it's a great opportunity to interact with colleagues working not just actually in Europe, because now the International Liver Congress attracts people from all over the globe. So I go to a lot of conferences around the world, and what's unique, I think, about EASL and particularly the International Liver Congress is how friendly it is. People are keen to come along, meet their colleagues. Sure, they might meet over a dinner or a drink, as well as in the presentation halls or around the posters. But it's always a friendly environment, and people are keen to collaborate. For me, I suppose the hot topics is probably what is going on in alcoholic liver disease. You know, alcohol is the main cause of cirrhosis and liver failure in most of the Western world. And for many years, it's been neglected. And it's really refreshing this year to see a whole series of abstracts presented as both oral presentations and posters on the topic of alcoholic hepatitis as well as alcoholic cirrhosis.